Hey everyone, talking a little bit more about does this patient have bunions, or what we talk a little bit more about as being hallux valgus or hallux abductovalgus. We talk about these in a few different grading options. Mild, moderate, severe deformity is sort of something that's really quite common to talk about, and it's very common to have a family history. Another common thing is for our younger soccer players or horse riders to be more affected, or those that have been wearing their high heels for a little bit more of their career. Pain and discomfort is typically apparent when you're going to be in your shoes, particularly if they're tighter or, like I said, high-heeled, and upon extended walking or hiking, anywhere where you're on your feet a lot more during the day. Now, when we look at the x-rays, we talk about two main angles here. There's quite a few others, but I'm not going to go into too much depth. And what we're looking at is the line between our proximal phalanx and our first metatarsal, and that's going to show you that degree of angulation of the big toe off that first metatarsal. When this is elevated, sometimes we can see that the big toe is going to go underneath or above that second toe, which may cause a hammer toe or a cock-up hammer toes. Some of you may be aware, that's going to be of a bit of a concern. But our main angle that I look at is that intermetatarsal angle, the angle between our first metatarsal and our second metatarsal. As that widens, it's going to increase the subluxation or dislocation of that big toe, and that's going to cause concerns because your foot's going to get wider and you're going to see that dorsomedial bump, that red area on the side of the toe, is going to become a bit more apparent and a little bit more painful. Now, when we're assessing bunions or hallux valgus, getting a good understanding of sort of how it looks initially, and then putting that joint through the big toe joint, the first metatarsophalangeal joint, through a range of motion. A lot of the time we're going to see that it's going to be maltracking, and that's going to cause a lot of concerns with the range of motion. The quality of that range of motion may be reduced right to the point where it's then not moving because it is dislocated enough, and that's where we're potentially looking more often at a surgical procedure if it is painful. There's quite a few different things that we want to make sure that we exhaust as well, so make sure that you're looking at your differential diagnoses. But for the moment, if you've enjoyed this video, hit the subscribe button, have a bit of a look at some of our other videos, and we'll see you there. Cheers.